Thank you for your interest in the 2019-2020 Lucas County Community Health Assessment. My name is Emily Gensler and I am the project manager, and I work for the Hospital Council of Northwest Ohio. If you started here to review the Lucas County African American adult data, I want to start off by mentioning there's an additional presentation posted to review the methodology of the Community Health Assessment. For example, you'll find information regarding the design, analysis of data, and response rates. Additionally, this presentation is only focusing on African American adults. Please check out the additional presentations for the general adult data, as well as the Latino specific data, also posted as youth and child portions of the assessment. The full report can be found on Healthy Lucas County's website at healthylucascounty.org. The very first section that we'll be reviewing is African American healthcare access. Underneath the main header, you can see all the different sections that fall into this category within the health assessment. I also want to mention that the full Lucas County Health Assessment is over 300 pages in length. We will only be touching on a small fraction of each section to give you a general overview of the type of data that you will find in the report. Starting with healthcare coverage, 89% of African American adults had health insurance, which left 11% who are uninsured in Lucas County. We ask why adults were without coverage, and you'll see the top 3 responses here at the bottom of the slide. The top reasons adults reported being without coverage was because they became a part-time or temporary employee. The pie chart is indicating healthcare coverage sources for Lucas County African Americans. The top 3 sources were employer, Medicare, and Medicaid, which is very similar to the general adult data in the full report. You'll also see options reported out as military, self-purchase, the marketplace, and private insurance as well. The very first graph that we will be reviewing is African Americans who are uninsured in Lucas County. To explain the graph a bit before we move forward, the first bar is looking at the total percentage for Lucas County African Americans in 2020. Then, as you move towards the right of the graph, we have the data broken down by gender, age, and then household annual income. Also, towards the right of the graph, we break down the data from previous Lucas County health assessments, starting at 2011 data for African Americans. Additionally, if you look at the bottom of the slide, we have uninsured rates since 2007 for Lucas County African American health assessments. Additionally, we have comparison data for Ohio and the US, so we can look at how Lucas County African Americans are doing in comparison to both. As you can see, very similar percentage as Ohio African Americans and a lower percentage than US percentages when comparing the data. The next section is healthcare access and utilization. You'll see where adults reported visiting for healthcare services when they were sick or needed advice. The top responses were doctor's office, urgent care, and then the emergency room. It's very interesting to see the changes in where people are going for healthcare services over the years. When looking at the last 2017 Lucas County assessment, we can see emergency room was at 51%. So we do see quite a decrease here from the 2020 assessment. Urgent care has also increased quite a bit from 20% in the last assessment to 35% in 2020. In this slide, we have some advanced care planning questions that were added in 2017. So now we have some new data in 2020 looking at these questions. 13% having a living will, and then 10% with a durable power of attorney. You can see both of those increase with age. Lastly, we have 38% discussing their medical wishes with a family member or loved one, and that is of those that did not have either one of those documents. Next, we have the preventive medicine section for African American adults, with 55% of the population receiving a flu vaccine in the past year. The highest percentage being for those 65 years and older, and then the lowest percentage for males at 46%. Our comparisons for this section is also looking at vaccination data for African Americans in Lucas County. The flu vaccine data has 2 separate categories, one for all ages and then one for those ages 65 and older. Overall, we see increases for the 65 and older population, but actually a slight decrease for those of all ages for the flu vaccine. For the pneumonia indicator for the 65 and older population, It stayed about the same since the last assessment and is right in line with where we're at with Ohio African Americans. Next, we have women and men's health specific sections looking at preventive exams. For African American women, we have data on clinical breast exams, mammograms, and pap smears. 77% of women had a mammogram at some time in their life, and then almost 50% had one in the past year. All of our indicators here for Lucas County decreased or stayed about the same since the last assessment. Also, we do realize screening recommendations change depending on the organization. We are following the CDC's questions and indicators when looking at that table at the bottom of your slide. For the African American men's health section, we're looking at digital rectal exams within the past year, with the highest percentage being of those 50 and older. Additionally, you can see the change from 2017 to 2020 with an increase in those receiving this exam. Additionally, African Americans were most likely to get this exam in the past year when we compare the white and Latino populations. You can find some of those comparisons looking overall at the different populations in the executive summary of the full report. The last section falling under healthcare access is oral health, with 44% of African Americans visiting a dentist or dental clinic in the past year. This decreased to 26% of those with lower incomes. When asking the main reason that adults did not visit a dentist, fear was at the top of the list. In 2017, 13% reported fear, and it was not the top response, so this has moved up in the list since past assessments. Then you can see our top oral health issues reported, which was pain, difficulty eating or chewing, and loose teeth. As mentioned in the previous slide, lower incomes were the lowest percentage that were visiting a dentist or dental clinic in the past year when we break this data into these categories. Also, African Americans had the lowest percentage visiting a dentist when compared to the white and Latino populations. At the bottom of the slide, you'll see the overall percentage of 44% being much lower than the Ohio and US comparisons. Next, we will be starting the African American health behaviors portion of the assessment with all of the different sections that you see on your screen, starting with health status perceptions. This section in the report is African Americans reporting on how they perceive their overall health, and that is both mental and physical health. The graph that you're looking at is overall general health being rated as excellent or very good, good or fair or poor. The lightest color at the top of the graph is showing fair or poor health for African Americans. When looking at fair or poor health, you can see the percentage is much higher in the 65 and older population. Also, when we compare African Americans to the white and Latino populations, African Americans had the highest percentage reporting fair or poor health. Our comparison table for health status perceptions is pretty large. The second row is showing our trends for those reporting fair or poor health, which has increased a few percentage points since the last assessment, also higher than the state and US data. And then overall, when looking at mental health perceptions and physical health perceptions, we have those that are rating their physical health and mental health as not good on 4 or more days. Both of those indicators have increased since the last 2017 assessment and are both higher than our comparison data for Ohio and US African Americans. Next, we have adult weight status for African Americans with data covering BMI, nutrition, and physical activity. Overall, 79% were classified as overweight or obese. Our statistician is able to calculate this using body mass index from height and weight, which is reported on the survey. Almost half of adults were trying to lose weight, and then you see your comparisons at the bottom of the slide with 34% being overweight, the same percentage as Ohio African Americans, and a higher percentage than Ohio percentages for obesity. Our BMI graph is broken into 3 different categories, those within normal weight, overweight, and then obese. The top darkest color is indicating obesity, with the highest percentage being those with lower incomes. A new question was asked regarding the usage of community parks, trails, and paths, and then what would help adults use them more frequently. The top response for African Americans were more accessible parks, and then also another high response was designated safe routes. Looking at the bottom bullet, 50% of adults were engaging in physical activity on 3 or more days per week, and that's for at least 30 minutes. And then 29% reported not engaging in any physical activity in the past week. Next, looking at consumption of fruit and vegetables, as well as sugary and caffeinated beverages. The table breaks this data down into 4 different categories. First, 5 or more servings per day, and then the last column being no servings at all per day. Barriers to consuming fruits and vegetables included too expensive, which was also the top result in 2017, and then did not have access and did not like the taste were all top 3. The current smoker percentage sits at 21% for Lucas County African Americans. You'll see how this has changed since past assessments in just a few slides. Keep in mind that current smokers is just cigarette smoking per the CDC's question. Cigarettes are still the top tobacco product, with little cigars and cigars tied for the second most popular. Lastly, we have a new perceptions of e-cigarette vapor harm question, and you can see adults perceiving it as most harmful to themselves at 65%, and 1% reporting e-cigarette vapors not harmful to anyone. This graph is indicating smoking behaviors for Lucas County African Americans, with the lightest color being current smokers. You can see the increase in those with lower incomes at 33%. Additionally, African Americans have the highest percentage of current smokers when we compare the white and Latino adults in Lucas County. Our first bullet is indicating adults who would support ordinances to ban smoking. Every category that you see in this list actually increased since the last assessment, showing more African American adults supporting these types of bans in the community. Also, when looking at the comparison table, we have more adults considered current smokers and less trying to quit smoking compared to the previous assessment. For our alcohol consumption section for African American adults, 46% of adults were considered current drinkers, and this is defined by the CDC as having at least 1 alcoholic drink in the past month. Again, with a definition by the CDC, we have binge drinkers, with 5 or more drinks on occasion for males and 4 or more for females. We have about 1 in 5 African American adults falling into this category. Lastly, 5% of adults were using a program or service to help with an alcohol program, and that is for both themselves or a loved one. Reasons for not using a program, the top response was had not thought of it or transportation. This slide is indicating adults who are drinking in the past month and the number of days they reported drinking. That lightest color is did not drink at all in the past month, and then the darkest, 3 or more days, with the highest percentage drinking more often being the higher income category. Our alcohol consumption comparisons are showing an increase in current drinkers for African American adults, but still a little bit lower than our comparisons. Also, binge drinking and those drinking and driving both decreased since the 2017 assessment. Next is African American drug use, with 7% of adults reporting being prescribed opioid-based medication and had trouble stopping. As a result of someone using drugs, adults indicated they or someone in their household experienced any of the following, with the top response being failed a drug screen. Next, for our comparisons, you'll see NAs are not available for the Ohio and US percentages. The CDC does not ask drug questions in their national survey, largely because they are not self-administered and asked over the telephone and are more of a sensitive nature. Less are reporting using prescription drugs in the past 6 months, as well as marijuana use for Lucas County compared to previous assessments. For those using marijuana use in the past 6 months, those most likely were females at 16%. Next, those with lower incomes for African Americans were most likely to misuse prescription drugs in the past 6 months. 57% of adults had sexual intercourse in the past year, with 6% of African Americans having more than one sexual partner, which is indicated in the comparison table. 9% of adults were forced to have any sort of unwanted sexual activity, which increased for those with lower incomes. 18% of those that were forced to have sexual activity actually reported it. The last section falling underneath the health behaviors category is mental health. The first bullet is showing 9% considering attempting suicide in the past year, which increased substantially since the last assessment in 2017, and 1% of adults actually attempted suicide. The second bullet is indicating 39% of African American adults were not getting enough sleep or rest almost every day for 2 weeks or more in a row, and 25% of adults feeling worried, tense, or anxious. The last slide includes information on why adults did not seek a program to help with depression, anxiety, or emotional problems, with the top response being had not thought of it at 8%. Additionally, adults reported other priorities, fear, could not get to the office or clinic, and took too long to get in to see a doctor as other top responses in this list. The next category is African American chronic disease, with cardiovascular health being the first section that we will cover. The first graph represents those actually diagnosed with high blood pressure by a doctor or health professional. The highest percentage of those with high blood pressure were those 65 and older, and those with lower incomes. African Americans had the highest percentage of those with high blood pressure when comparing the white and Latino adults in Lucas County. Very similar trends for those diagnosed with high blood cholesterol, with the highest percentages for those with lower incomes and 65 and older. The indicators on the trend summary table are showing both high blood pressure and cholesterol increasing since the last assessment, but we also see more people getting their cholesterol checked within the past 5 years. Both heart attack and stroke were similar to Ohio and US comparison data. Next, moving on to African American cancer, 11% of adults were diagnosed at some point in their lives. Those diagnosed were most likely to report prostate, breast, cervical, and lung cancer. Moving on to the arthritis section, 23% of adults were diagnosed with some form of arthritis, which increased and actually doubled with age. 19% of adults were diagnosed with asthma in 2020, which increased since the previous assessment and was higher than our comparison data. Additionally, those that were diagnosed with asthma, 69% were receiving treatment. We also have some information for COPD, with 5% of adults being diagnosed. 15% of adults were diagnosed with diabetes, with all African American adults reporting they were receiving treatment for it. 38% of those with diabetes rated their health as fair or poor. African Americans with lower incomes and those 65 and older were most likely to have diabetes. Also, African Americans were most likely to have diabetes when comparing to white and Latino Lucas County adults. Quality of life is the last section within chronic disease, with 48% of African American adults reporting arthritis was their most limiting health problem. The last section we will cover is social conditions, which encompasses both social determinants of health and environmental conditions. The first section is social determinants of health, and the CDC defines social determinants as conditions in which people live, learn, work, and play that affect a wide range of health and quality of life outcomes. The section's then divided into the full Lucas County report into 5 key areas, which are economic stability, education, social and community context, health and healthcare, and then neighborhood and built environment. This first slide is specifically looking at food insecurity for Lucas County African Americans, with 19% of adults choosing between paying bills and buying food. 8% of the general population fell into this category. 11% were also worried food would run out, and then 14% experienced more than one of these food insecurity issues, which actually was more than double than the general adult population and the Latino population. This next slide is Adverse Childhood Experiences, or ACEs. These ACEs are traumatic events that occur in childhood. So the question on the survey asks, did any of the following occur under the age of 18? Some of the options include witnessing abuse, violence, or having a family member attempt or die by suicide. These ACEs are then linked to chronic health problems later in life. And this question was actually asked in all of the populations we surveyed in Lucas County. So you're able to compare these changes across the age spectrum. For our adult ACEs question, we look at those who experienced 4 or more. As you can see, 18 experienced 4 or more ACEs in their lifetime, with more males than females experiencing 4 or more. Next, we had quite a few questions looking at discrimination, which could be based off of skin color, ethnicity, religion, etc. When asked if adults experience feeling emotionally upset as a result of any of those categories, most felt emotionally upset based off of their skin color at 24% and ethnicity at 21%. 33%, so 1 in 3 adults, felt emotional distress based off of any of those categories, as well as physical distress. We also look at experiences when seeking healthcare and if adults feel they were treated worse, better than, or the same as other races. As you can see in the table, this is broken into African Americans, whites, and Latinos, with the highest percentage of those feeling their experiences were worse being African Americans. The white population had the highest percentage reporting their experiences were better than those of other races. Our last section is environmental health, with African Americans reporting bed bugs and mold were most likely to threaten their health in the past year. Thank you for your time and interest in the results of the 2019-2020 Lucas County Community Health Assessment, specifically the African American sections. Please remember to review additional sections of this presentation that you might be interested in, including the general population, Latino, or the youth and child data. Of course, you can also check out the full report posted on Healthy Lucas County's website. Before we finish, I also want to encourage you to fill out a participant feedback survey with more information coming up on the next slide. Here is the link to the participant feedback survey on the SurveyMonkey platform. We ask questions that will help the Executive Committee of Healthy Lucas County move forward. They will be planning for their Community Health Improvement Plan, which is the next step in this process. Thank you.